Good morning, Ann Lynn, and a few we have here. This is Barbara Wash from the Department of Medicaid Services. It is 11 o'clock, and I'm still clearing the waiting room.
Thank you.
We currently have Marlene, yourself, and Evan on at this point,
And Susan.
Yeah.
and Susan.
I'm here, but I'm driving, so.
Okay,
Drive carefully.
so there's 4 out of 5.
Yeah. Are you ready for us to start, or you still have people to
Nope,
clear?
I just got the last person in, so you're good to go.
All right.
Thank you.
Welcome everybody to the Home Health TAC meeting. We'll start with introductions. I'm Alan Purdon, Executive Director of Hazelwood Home Health.
Susan Stewart, CEO, ARH Home Care Services.
Janet Marlene Reynolds, Regional Vice President, LHC Group.
I'm Evan Reinhardt with the Kentucky Home Care Association.
Thank you. We've already established we have a quorum. Is there a motion to approve the minutes of the last meeting? And that was October 14th.
I'll make that motion, Susan Stewart.
I'll second it.
We'll do, if anybody's opposed, they can speak up. That's probably easier. Nobody opposed. Those are approved. Evan, do you want to do old business?
Sure. We're just, excuse me, looking for any updates on our ongoing supplies quantities issue and questions.
I did see that they sent out, and we don't do passport, but
Right.
of those limits. So I wonder, is passport saying that these are the only items that they have limits on? I don't know if anybody even on the TAC does passport, but
This is Anna Page. I'm the director for the Utilization Management Program for Passport, so I can possibly help you with this question.
thank you.
Yeah, so I did from a perspective, for home health services, we require off for, of course, skilled nursing visits. There are 6 visits off free, which means that the provider does not need to get the authorization to the member. Member has used 6 visits. For home PT/OT speech, it's 20 visits per each therapy type. For the supplies, we in utilize the DMS fee schedules on the limits. So there are certain limits on the DMS fee schedule. And if a member goes above those limits, we would require an authorization for services or supplies above those limits. So for example, and I'm just throwing this out there, it's probably not an accurate example. Gloves, for example, let's say, that's probably not a good example, but if you get 50 a month and the home health agency needs 70, then they would need to get authorization for any of those limits beyond that of the fee schedule. And that's what we utilize in From a claims payment perspective, I also included the fee schedule on the payment. And that would, of course, we would follow the fee schedule, but we would also, if there's any contractual variances, that would be followed as well. And I don't have the specifics on the contracts, but we follow the fee schedule. But from it's anything that's over the limit would require authorization. Other than that, if there's no limits, no authorizations required for specific supplies related to home health. Does that help to answer your question?
That does.
Good.
It'd be really nice if all the rest of it would put that out.
Yeah, it's really it's from it's pretty simple. If there's no limits on the fee schedule, the supplies don't require off. It's the skilled nursing, of course, that requires off that after those parameters. But other than that, it's fairly simple.
Thank you.
You're welcome.
Were there any other updates from any of the other MCOs or from DMS?
Evan, this is Barbara. I do see that we received several responses through email, and I'd be happy to share that with the committee and the follow-up notes. Evan, you're muted.
Yep, we'll wait for the emails and then Ammon, do we want to jump down to EPSDT and see
Sure.
what folks have for that today?
Yep. I didn't know if like DMS wanted to present anything or just wanted me to ask my questions.
Um, I I actually had someone from DMS contact me today, and that was Justin. I don't know if Justin's on at this point.
Hey,
There he
Barbara.
is.
Hey, Barbara. This is Justin Shaw with the Child and Maternal Health Branch in DMS. I think Barbara sent me over a question this morning. It was if the MCOs, if there's going to be any changes to go along with that PT 45 billing change in January. Is that your question to address? Just want to make sure. Uh,
So yes, that's
okay.
part of it.
Okay. So right now, there is no requirement for MCOs to change their billing practices beginning January 1st. It's just for fee for service at this time, as long as you're still being paid your contracted rates with the MCOs for that EPSDT service. Um, we don't have a presentation for it today. We do have a meeting on Monday morning, the 15th, to talk about the upcoming changes. I can put an email address in the chat if you would like to attend, if you know anybody who would like to attend, where we're going to discuss it a little more in depth and answer questions that may be there.
Okay, that'd be great.
So I will put it's Ivy Sams is our EPSDT coordinator, and she will send you the meeting invite. So I just put that in the chat for you. And anyone you think that might want to attend, feel free to forward that to or to give the email
And
address.
I'm sorry. And when did you say that meeting was again?
It is Monday morning, the 15th at I think 11. Let me double check real quick. I'm sorry, 1 to 2 Eastern on Monday, the 15th.
So that would be the place for me to ask my questions.
Probably, yeah, she'll be
Okay.
much more equipped to answer those
Okay.
for you.
Thank you.
You're welcome.
And from any of the MCOs, does anybody there want to answer if they're going along with these changes or if we continue billing EPSDT as we currently are? Well, billing and authing. Anybody from WellCare?
Hi, this is Justin Derringer with the Department for Medicaid Services. I did want to say that this particular change only applies to um, therapy providers that are billing therapy services through EPSDT Special Services. It doesn't apply
So
to any other EPSDT service, only if you are a therapy provider billing therapy.
that would be us, right, Evan? Susan? Anybody else that does EPSDT?
Yeah,
I
I
think
believe so. Yep.
I think we're considered therapy special
Okay.
services.
Yeah, and so like Justin said, on the 15th, we are going to have that meeting, and I believe each managed care organization is going to have a representative there to answer questions as well. So
Okay.
yeah, and
That'd
so
be good.
and just a few real quick points. It does start January 1st. However, we're going to have a 90-day grace period. So as providers kind of get adjusted, so it's not like January 1st is the end all be all date. We're going to have a 90-day grace period to get everybody kind of acquainted with the system, how to bill it. If you currently bill through another provider type, through fee for service, it's going to be billed the exact same way. The only difference is that there will be a modifier that you use for physical therapy, a modifier for occupational therapy, and a modifier for speech therapy. So those will be really the only difference from billing between um, your state plan and your EPSDT. You're still going to bill the same exact codes for the treatments that you're providing, the same amount of units per how much time you're spending on each one of those treatments. Um, so just like you would through your state plan provider type or service, but those modifiers are going to be what differentiate between EPSDT and regular state plan services, and then of course which provider type you're billing from. Now later in 2026, we'll use another modifier that you can attach, an EP modifier that will delineate, and you can bill whatever provider type you want, and we'll be able to pick it up. But um, that's really the main change is that we're going from for fee for service allowing 3 S codes to be billed for therapy services to billing exactly the same way you do for any other provider type uh, for therapy services. So you're going to use the appropriate 9 codes, the appropriate time that you spent or units for each code. It allows us to comply with CMS requirements, but it also allows us to be able to get a complete and comprehensive picture of what services each one of our members are receiving, how much time they're getting with those services, to help us better care and manage their healthcare needs overall.
Thank you.
You're welcome.
Unless anybody else has any questions for EPSDT.
Hi, this is Ashley with Aetna Better Health. I do have a quick question. Does this apply or is there any difference when it's therapy provided in the home versus outpatient?
Actually, I just had to look at because I don't have all my provider numbers memorized, and my EPSDT provider number is a 45. So, and we provide it in the home.
Okay, so the same, I mean, technically the same rules will apply beginning January 1st.
Okay, thank
Reg
you.
And I mean, that's a
Oh, that's a
clarification
question.
question.
Oh, okay.
I just want to make sure, that we're processing those correctly.
Yeah, so
It,
in home and in office will be again the same as if they're billing through their state plan provider uh, services. So it doesn't differentiate between in home or out of home. They would have the place of service code still listed on there, just like they were billing through, say, like a provider type 76.
okay. Okay.
Could you review the dates of that meeting again, please?
December 15th is our next EPSDT therapy billing change meeting. It's December 15th at, let me look, I'll tell you specifically. 1 o'clock p.m. on Monday, December 15th. So this coming Monday at 1 o'clock. And if you don't have an invite to that meeting, then feel free to reach out to Ivy Sams. She can get you added to that, and her email's in the chat.
And Evan, could you send that email out through the email association email?
Yep. I sent a request to Ivy to add us, and I'll get the
Oh,
information and send it to everybody. Yep.
awesome.
And this is Barbara, and I'll make sure that they're in the follow-up notes.
Thank
you.
you.
Mhm.
Thank you.
All right. There's nothing else on EPSDT. Our next one, I don't know. I don't think this one was mine, was it, Evan?
No,
Is this okay?
it's something we've talked about in the past. And I
Oh.
think the fee schedule was due to be updated. So we hadn't seen anything on that. And specifically, we needed the additional sizes for the adult undergarments extra large to be added to the fee schedule. So we were just going to see where we are with an update on that.
Oh, I think was that probably was mine in the past, the code for
Yep.
anything above extra large, and I believe it was for pull-ups. They had one for the actual diaper, but not the pull-up.
Yeah, you had brought it up in the past, but we
Yeah.
actually had it get brought up again. So we definitely want to follow up on that if we could.
Is Kelly Kitchen, is she on the call? Well, if
I
she's on here or not.
I did not see her
Okay.
come on, Justin,
Well,
but
Kelly Kitchen is our branch manager for the physical health branch, and she kind of oversees our fee schedules. I know that this is something that she has been working on, and she had uh, something kind of put up there for today, but we're still working on that fee schedule. So as soon as that comes out, but we'll kind of address that on there. But we'll get something back to you all through email before that, because sometimes our fee schedules take a little bit longer because all the approvals they have to go through.
Thank you. Anything else, Evan, or are we ready to move on to general
Yep, that's it.
discussion?
That's it for
Okay.
now.
And was this data report a specific request? Oh,
Yeah, I think that's one maybe from last time we were talking about to present the data on. I don't remember that this was something we brought up in between the two meetings off the top of my head.
this was actually, no, this is Barbara from DMS again. This was actually in a note to put onto your agenda that there was a data report from DMS denials. The data request you are to request it at this meeting, and hopefully we'll have it all together for February of 2026 meeting.
Do we need to do anything to formalize the request, Barbara, or we're good to go for that?
I don't believe so, but I have to do a double check. Oh, Justin's on. Go ahead.
No,
No.
no,
Mm-mm.
we're good. We'll get it taken care of for you.
Okay,
Yes.
thank
thank
you. I
you.
Yep.
appreciate that.
Yeah. Thank you.
With that, I don't believe we have any recommendations. Nope.
None for today.
And Susan is still our MAC meeting representative. I'm assuming
Yep.
she's still attending those meetings. I don't know if she's still on or not.
I am.
Oh,
I'm
there
right
she
here.
is. She's
Right
still
here.
driving.
I'm still driving. You get to see the beautiful East Kentucky.
There we go. All right. And our next meeting, February 9th, 2026, if you can believe it.
Yep.
So if there's nothing else for us to review, I'll take a motion to adjourn.
So move.
Second.
Nobody objects. We're adjourned.
All
Thank you,
right.
everybody.
Thanks, everybody.